Hi everybody, I'm Dr. Elena Poulos.
I'm Dr. Marnie Fisher.
And we're dermatologists at Kingsway Dermatology. We've been working together and known each other for what?
20 to 25 years.
We're here to talk about Ozempic. Of course, it's such a popular medication right now, and for good reason. It's helped a lot of people lose a lot of weight, which is fantastic for people's health, especially for people that have issues with diabetes or pre-diabetes, getting them onto a healthier way of being and hopefully for the rest of their lives. So Ozempic works with a few mechanisms. Number one, it definitely suppresses appetite. So people on Ozempic really can't or won't eat as much. They're just not as hungry. Mm-hmm. It also slows your intestines, so the passage of food through the intestinal tract, which will slow down the absorption of glucose into the bloodstream. Mm-hmm. And as a consequence, you get actually less insulin release. So that's another major mechanism.
Lots of good safety data,
yeah,
and lots of good endpoints, lowering that hemoglobin A1C. That should be, everyone should know their number, and it should be a healthy number.
Exactly. Yeah. So keeping your blood sugar down, your insulin level reduced. Mm-hmm. So long-term, helping with our longevity, fewer risk of a heart attack, stroke, mm-hmm. even cancer, although we don't have proof for that yet, but
yeah, and sugars in the bloodstream, and as an average, that hemoglobin A1C number, sugars are one of the number one aging, globally all over aging issues and problems for humans.
Exactly. And the data is still coming out, but for everybody that's on Instagram, I'm sure everybody has seen the reels with lower your blood glucose level, right? Slow the absorption of glucose and all of these hacks that are out there about what you could do.
What do I do if I'm in my 30s versus if I'm in my 50s? Is there a difference between taking Ozempic and what those outcomes are that we hear about called Ozempic Face?
Yes. So
is there a difference?
So we're starting to see that, right? Mm-hmm. Of course. So the Ozempic Face, and some of you probably have heard about it. Okay, so Ozempic Face really happens when people have lost a lot of weight. If people are losing 30 pounds, 40, 50, 60 pounds, right? So that weight and that fat loss, it's not just coming from the midsection. It really comes from the entire body, including on the face. And so when we lose the fat, right, so your fat, your subcutaneous fat, it's the layer right underneath the surface of your skin.
It's everywhere.
It's everywhere. Yeah. It's everywhere.
Keeps us warm.
Yeah. And cushioned.
Cushioned.
And cushioned. So that fat underneath the surface of the skin, particularly on the face, is what gives people that healthy look, right? So you got your rosy cheeks, it provides support for your skin. That's what your fat does for you.
But you know what's also in the fat?
What?
Progenitor cells and stem cells
True.
And connective tissue matrix.
Yeah.
Connective tissue fibers
Yes.
that are all connecting everything together so that it sticks and it's gelled together.
Exactly.
Without a lot of those components, everything starts to kind of sag. Right. And sink, and then it gives that look that nobody really wants.
The S word, the sagging, the sagging word. Mm-hmm. So yeah, exactly. So imagine you got your skin here. It's like a sandwich, right? So you got your skin here, you've got your muscles and your fascia down here, and in between, can you demonstrate? You've got your connective tissue fibrils right in between, which are sitting exactly in the fat. Mm-hmm. Okay, so what happens is when that fat layer all of a sudden is disappearing, those fibrils are getting softer and weaker, and certainly in older decades compared to the younger decades, when the elasticity and the tautness of those fibers are less, you start seeing the two layers slide, right? So instead of it seeing nice and tight, the top layer, which is our skin, starts sagging down. Mm-hmm. And that's when you get people complaining about the jowls. And especially if there's been a rapid change, you see the sagging of the cheeks. Mm-hmm. So then, the question really is, what do we do about Ozempic Face?
Right.
So what are the options? So certainly surgery is an option. And there will be some people that probably would want to consider doing a facelift, right? So if the degree is pretty severe and you really don't feel like yourself, a facelift definitely is an option.
Neck lift, facelift combo.
Yep.
Always good option.
Yep. You know, we know that a facelift is certainly not in the cards for everybody. Risk of complications are there no matter what procedure you do, but particularly a larger surgical operation like a facelift. So risk of complication like an infection, there's pain, there's healing, there's downtime, which would be, I guess, 1 to 3 months, I guess, if you're doing a big facelift and a neck lift. There's many reasons why maybe somebody would not want to pursue it or maybe defer a decision to do a facelift.
Non-surgical.
Yeah. And then there's non-surgical options, right? So if
Non-surgical.
you've kind of ruled that out, non-surgical options.
Non-surgical options are targeting the targets and the layers in the skin that we earlier alluded to, which injectables, they can reproduce and recreate those deep fat pads, devolumize. They can be injectables that give a biostimulatory effect into that superficial fat layer, into the hypodermis. We've got some energy-based devices that bulk heat and or target specifically into those layers above and below on the face. What's nice is right near the platysma muscle, which is this big muscle that is supposed to, you know, be up. And then as we get older, it tends to sag. So that's what happens in the face specifically in this area with the jowls. So now we have one that we do called PRF, and it stands for platelet-rich fibrin. The patient's own platelets are mixed with the patient's own thrombin on the spot and injected into deep connective tissue, deep fat pads, provides a regenerative but very personalized boost to the skin. Typically using PRF in face, but also in neck. Very, very amazing results.
So we're not producing a lot of collagen on an ongoing basis unless there's a stimulant.
A nudge.
Okay? A nudge, right? So how do we nudge it? We use the energy-based devices. We use, you know, injectables with biostimulatory type products. And PRF is basically the natural hack, right? So it's the way of stimulating that collagen production, but by biohacking, right? Rich with your own growth factor. So in this case, we're injecting the growth factor into the tissues to wake up the fibroblasts, and it's those fibroblasts then that lay down the collagen in the areas that we want. So that's really the whole concept behind it. So lots of options.
And we always like to say, it's not an either or, it's a and.
Often the way that you combine these treatments, right, it has like a multiplied effect, not just additive, but a multiplied effect. And of course, the most distressing thing is when people look at themselves and it doesn't really match, right, how they're feeling on the inside. There's a lot that can be done. So I think that's the whole point, right, is do what you need to do for your health, to feel great. And if these other things are starting to happen and change and you don't like it, there's definitely a lot that can be done.
Oh, and don't forget to wear sunscreen.
Always a sunscreen.